Hey girl, hey. Okay, so as promised, girl, we about to have some fun tonight. I'm sorry the video is late, but the girl has some stuff to do, and I'm sorry, very, very sorry. Okay, so perimenopause, pissy, and out here smelling handsome. Now let me tell y'all where that came from. So this week was my week in the office, right? And y'all know the kind of cutting up we do in my office. We enjoy each other and we have a good kiki, okay? So actually two patients, maybe three, came in complaining this week of the same thing. But one of my patients is hilarious, and I know you watching, so shout out, girl. I told you I was gonna do this. So she's freaking hilarious. So she's like, Doc, something has to be done. And I'm like, well, what we talking about? Like, what you mean something has to be done? What's going on, sis? And so she's like, so I'm at an event. And I'm like, okay. And she's like, I keep smelling, somebody keep walking past me, and I keep smelling boiled onions. I said, not boiled onions. Like, she was like, boiled onions. And I was like, okay, keep talking. So she's like, the person keep walking past. I said, well, did you say something? She was like, no, because after about 10 or 15 minutes, I turned my head real sharp and I caught my underarm and it was me. I said, oh. I said, oh, you out here smelling aggressive. So I said, well, why? And she was like, let me tell you. She said, I didn't ask I run me straight to CVS. I said, well, did you get the clinical strength? She said, I didn't want the clinical strength secret. I wanted some degree. I wanted some Axe. Okay, I said, well, I like me a man who wears that nice new Old Spice. That smells delicious. She's like, the swagger? Oh, I got that too. She said, yeah, Doc, I'm out here smelling handsome. I said, close the office for the day. Who is at the front desk? Because we done for the day. Shut down the computers. Turn the lights off. We done. Nobody gets any more prescriptions because you're not out here smelling handsome, are you? Not out here smelling handsome. So I said, Lord have mercy. And then somebody else was like, Doc, what is happening? I'm smelling like my son. So I said, okay, it's time to break this down. Okay. And then the girlies we're going to talk about. These are secrets that women keep, and sometimes they even keep them from each other, which we got to stop this foolishness because nobody is on an island by themselves, okay? I can promise you, if you feel like you're suffering from it, your girlfriends are suffering from it, your family is suffering from it. If you feel like you're suffering, folks is out here suffering, okay? So let's not be alone with this, but let's talk about the smelly pits and just the overall change in body odor and body fragrance. When we start to go through menopause and the perimenopausal, perimenopause, menopause, and postmenopause, y'all done seen the difference. If you haven't seen the difference, go back and check out my video. This ain't the time nor the place, okay? Now, and don't let your man watch this with you, because some of y'all just be watching stuff with y'all. Y'all be watching too much with them sometimes. All right, so this for the girls. This is secret for the girls now, okay? And if you ain't in your perimenopausal, listen up, because you will be, okay? Now, for all of us cougars, which I think are now the millennials, and the Thundercats, which is the Gen X's. I really like this title, but that's a whole nother video for another day. But anyways, what starts to happen is your estrogen starts to drop, okay? Which is the start of it all. It's the start of the end, but whatever. The estrogen drops and your testosterone levels they start to rise a little bit. Why? People don't realize that testosterone is actually a precursor to estrogen. When you're young, you have just as much testosterone, but it actually gets converted to estrogen. So we start with testosterone and it's converted to estrogen. Where as we get older, that conversion slows down, child. It slows down. We get a buildup of testosterone, not enough estrogen over there, and stuff just like Beyonce said, to the left. Yeah, that's where everything is going, to the left, okay? And so that's what starts to happen. So with the increase, honey, and testosterone, things start to change. It is not your imagination. Things are changing. You are not dirty, sis. Well, you might be dirty. We're going to talk about that. But at the end of the day, it's not only because you're dirty, if you're dirty. And if you're dirty, it's okay. Just own it. We're going to get better. okay, for the remainder of 2025 and all of 2026. When you know better, you do better. So we're going to get better, okay? So there's no judgment here, sis. All right, so what happens is the composition of your sweat changes. So, you know, we have epicrine glands and apocrine glands. You probably didn't know that. Don't even worry about it. You don't need to know that, okay? It's my job to know that. So we got epicrine glands and apocrine, them the stinking ones. That is when the bacteria, it breaks down and it's like odor causing. It's like the thicker sweat. It's associated with menopause, it's associated with stress, different things like that. And so the apocrine glands, they really start to ramp up. Okay, so with the increase in testosterone, we see the change in the sweat composition due to the stimulation of those apocrine glands. Okay, and so that's really it. Also, increase in stress and anxiety. Why? Your cortisol levels go up, and more anxiety, more stress, more sweating. So again, and then when you get the sweating, it ain't the cute little thin little sweat back in the day. It's the silverback gorilla sweat. I'm just saying. A hit dog will holler. Don't be upset. We all go through it. It is what it is. Okay, it ain't how many times you fall. It's how many times you get up, sis. Get up, sis. Stand up. Don't drown in 3 feet of water. Just stand up. Okay. All right. So let's get back on the thing. So now when it comes to, it's like, okay, well, what can I do about this? Like, what do we really have going on? Okay. Because, and you're also sweating and did you know? And I always tell my patients this because I tell them, listen, honey, water is nature's elixir. Water gonna fix everything. I'm telling you, water, because when you're dehydrated, your sweat is more concentrated, and concentrated sweat stinks worse. Okay, and baby, y'all know how y'all be sweating with them hot flashes and them night sweats, baby. Okay, and y'all got to be careful. Get some Clean and Q Home on them sheets, because you're rolling around and y'all like to not change these sheets for about 2 weeks, and you're rolling and flipping and flapping and got all the apocrine sweat all up on your sheets, and you're going to work smelling like, stale, I don't know, baby diapers or something. I don't know. But don't subject everybody to that. If you know it's a situation, it's okay. Just address it. Clean and Cute Home will get you together. Okay, keep them sheets nice and fresh. Okay, keep the mold and moisture and that wet diaper smell, all up off because my mouth ain't gonna say it, my face sure will. So but yeah, so anyways, so yes, we want to make sure we're hydrating. Hydrate. You guys know I always tell you, alkaline water, no disease can live in an alkaline environment. Your body has to be acidic in order for the disease to be able to live and thrive. So try and get your body as alkaline as possible, all except your vagina. Try to get your body as alkaline as possible. Water, alkaline water, coconut water, snack on cucumbers, water, okay? So make sure you're hydrating very, very well. One, is going to keep your body temperature cooler. It'll keep you away from that concentrated sweat. It'll help with, ain't really going to help too much with the hot flashes, but it'll help a little bit, okay? So what can we really do? I would change my my hygiene routine. So, some people are into just bathing at night or just bathing in the morning. If you notice that this is something that's really affecting you or your life, you might want to consider bathing twice a day. Also, yeah, girl, I'm going to tell you to use that Clean and Cute body wash bar. That thing is going to kill the bacteria off of the skin. Now, this is one area, and I'm going to be selfish with it. This is one area where the Clean and Cute body wash bar is going to outdo the Dove. It's going to outdo the Dove because while Dove is not going to cause a vaginitis, it's not going to cause any issues, it's not going to be as cleansing to the skin, the body, and all the bacteria that you're picking up and that live in that apocrine sweat. It's not going to be as cleansing as the Clean and Cute body wash bar. I'm going to be very honest with you. So get you some, try it. So that's a thing, but hygiene twice a day. And as far as deodorants are concerned, I would say start with the Clinical Strength Secret. If that is not taking you where you need to go, girl, do not be afraid to go over to that men's section and get some of that. Now, like me and my patient was talking, Old Spice, they got some real cute scents over there. Okay, real cute. So I smelled a couple of them, was like, don't get yourself into something you can't get yourself out of smelling like that, sir. Okay, because so they got some, nice little fragrances over there, and perfume today is unisex, so you ain't got to be all smelling like vanilla and cherries and all that kind of stuff, girl. Please, as long as you smell good and fresh, because you can smell like vanilla and cherries and have that onion undertone. We smell it. You ain't perfumed that away. We still smell it. Okay, so anyways. So don't be afraid to get that swagger from Old Spice. Old Spice got a lot of fragrances, but Axe is good too. Old Spice, and ain't nobody paying me for this. Y'all can if y'all want to, so tune in. But Axe, Old Spice, Degree. It's another real cute one. I can't remember the name of it though. But anyways, so, and I think Dove has a men's too, but I don't know how many fragrances they have. But Old Spice is, they're going to be winning the game right about now. So yes, that's something to consider. And don't be afraid to do it. It is what it is. It is what it is. Also, as far as managing your stress, and this is where it comes when it's menopause is not just about a period. Menopause is not just about a hot flash. It really is about changing your life to have a better quality of life, right? So, even managing your stress, that is meditating, that is praying, that is finding private time, quiet time, journaling, yoga, walking, anything that's going to get your cortisol levels down, get your stress levels down, so that we won't, our anxiety is not running through the roof, our cortisol levels are not running, and we're not sweating. So those are different ways in which, what else can we do? Outside of that, if therapy is on your purview, it's been on your purview, it's something you've been wanting to do, what's the problem, sis? Because we can pray and be in therapy. How about that? Also, breathable fabrics, okay? If you in that sweating phase in your life, the sisters, Polly and Esther, that they ain't for you, okay? We ain't inviting them over. Let's get some breathable fabrics. Let's get some cotton, okay? Let's get some cotton, okay? And you ain't just got to be, cotton down. But like I said, Polly and Esther, we might want to sit them down for this season of our lives, because they're going to have you in a chokehold. Baby, they get to sticking to you. You ain't got to do all luxury, high luxury fashion. I'm not saying all that. Because I don't do that. I'm not saying all that. But, if you in the space, like I said, Polly and Esther, they ain't going to apologize. They do what they do. Okay? Also, cooling aids. Like, one thing that I definitely do, I have cooling pillows, okay? Spend the money. Each pillow might be like $30 or $40 or something like that. It sounds pricey, but they do last though. But spend the money. It's like when you lay on this pillow, it helps with it helps with night sweat so much, and it's so cooling. It's just, it just helps so much, because you know how you got one leg over the cover, one leg under the cover, one leg and back and forth, and it don't really help none, because the leg that's under the cover be hot, the leg that's over the cover be cold, and you just can't get balance all night long. So you figure, I put one under, one over, and I'll be cool. The girl math don't be mathing for the night sweats. So the cooling mattresses, the cooling pads, if you can't or don't want to invest in that, that's fine. But those cooling pillows, they understand the assignment. They definitely understand the assignment. So that's something that you might want to look into. But again, it's lifestyle changes, making sure you stop stressing your body out trying to metabolize all these damn fattening and processed foods. Stay your behind home, cook something, meal prep something, or you gotta like that, have somebody cook something for you. Eat whole foods, not from Whole Foods, because child, that's a whole situation. But I'm just saying, eat whole foods, grains, fruits, vegetables, more fruits and vegetables, poultry, different things that your body can use, and it's not going to spend so much time and energy and metabolic, energy trying to break down and all the things, because girl, who? So just things like that, changing your lifestyle and literally thinking about your quality of life. The way sometimes I break down to my patients, who are in my metabolism management program, when you first started this program, and I always tell them, by no means am I saying, I might have said this in another video, I don't know, but by no means am I saying that, when you were bigger, you were worth less. That's not what I'm saying. But when you first started the program, let's say you were a Honda Accord. It's okay to put 89 in a Honda Accord, because it's going to be all right, right? Okay, girl, we got 89 in that Honda Accord. But now you've made the changes, you're exercising, you're eating properly, you've lost the weight, you're no longer pre-diabetic. Let's upgrade to a BMW, okay? Or a Mercedes, or a Porsche, my personal favorite, or a Porsche, right? Then what ends up happening? Okay, you can't put 89 in that. 91, 93. 91 or 93. And your body is the same way. Once you've gotten to a point in your life, you have to upgrade. Eat better quality of foods. Eat better types of foods. Eat better. This is a time, you've never had a rutabaga before. I don't know how to cook them either. But Google is for everything. Get on YouTube and see how them folk over there making rutabagas and all that other stuff. You know, I don't know, stuff that, you know, you never heard of, or, you know, learn it. Taste it. Venture. You know, you people always think you have to travel to have experiences. Baby, make that whole kitchen, you know, a whole, you know, Portuguese experience one day. Go figure out what's, you know, a whole Japanese experience one day. Just upgrade. Give your body, put in your body what you want out of your body. Okay? So that's one of the biggest things. And now y'all understand, but you know, yeah. The men's section just ain't for the men no more. Show ain't. Now, this whole pissy thing. Woo, child, I love myself. Okay, so because you know why, I'm okay, you know, laughing with you guys and, you know, not taking everything so seriously, especially when things can be fixed. All right, so when it comes to the whole pissy thing, a lot of people are very, very, very private, scared to discuss it, don't want to discuss it, and don't get help because they don't discuss it, okay? So they out here wearing them, what they call the poise pads. Is that the one that catch the pee? Yeah, they out here with poise pads, or better yet, the little Depends. Now, why Depends gonna try to have a G-string? Depends. I need y'all to talk to me. I think it's funny as hell, and I love it. I love it for anybody who needs them, because just because you need a little Depends, you shouldn't have to have the big granny drawers on. You should be able to have you some thongs on too. I don't know who came up with that in y'all marketing department, but I know that meeting was a time. It was a cackle, because baby, you couldn't pay me to be in there, because it wouldn't have been a straight face in the room. You hear me? But it's cute though. But yeah, so the poise pads, the little Depends bikini, I mean the little Depends G-string. Girl, let me move on. Before I say something I'm supposed to say. Now, when it comes to, again, because of that lower estrogen level, what happens? All the tissues kind of start to thin out. Like the tissues of the vagina thin out. That's why the vagina gets drier and, you know, a little bit more itchy and irritated, and sex can become a little bit more uncomfortable if you don't do all the things like, you know, and we'll talk about hormone replacement, which again, yes, that will help with the smelly stuff as well, but we're gonna talk about it at the end. Even the tissue, the little pee-pee hole, where the urine comes out, with the decrease in estrogen, the tissue around there starts to thin out too. Okay, so it's a two-pronged approach when you have something called stress incontinence. So stress incontinence is when you cough and sneeze or bear down, you laughing real hard, and all of a sudden, see y'all laughing at somebody, laughing at her little edges or her shoes or whatever, and boom, now you're pissy. See, that is God's payback for you not being right, but that's not the point. That's another video. The point is that whenever you bear down or put pressure on that bladder, either a little bit of urine comes out or a whole lot of urine comes out, and that's why you got the little pads on so you don't be stinking. And again, the little urine come out and your panties start smelling fishy. One, that's an indication you need some new panties. Two, is an indication you don't use the clean and cute panty wash, okay? You got to get all that, you know, discharge and vaginitis up out your drawers. That's why when that little bit of urine hits, your panties is fishy. But anyway, more importantly, is there a way to fix that? Absolutely. Why does it actually happen? Again, because the tissue around what we call the urethra is what holds the urine in. It starts to thin out. And so when you put any pressure on it, it can't really hold as well. Also, associated with menopause, again, is you get an increase in abdominal fat. And again, that increased pressure is pushing down on that little sphincter. We call it a sphincter, but it's a little like, you know, like bow tie, whatever, that holds the urine in, is pushing down on that. And honey, all that weight on that tummy is way stronger than that. And boop, that push down, the pee comes out, and boom, there you go. Problematic. Okay, so the increased abdominal weight, the thinning, the decreased estrogen, which makes the tissue around the pee-pee hole thin, and then also too, the pelvic muscles start to weaken. We get older, we've had children, and again, you know, just with the whole perimenopausal or decrease in estrogen, those pelvic floor muscles is like, girl, I'm tired. I done enough. Okay, I done paid my dues. Okay, I'm tired. All right, so you pee on yourself. That's a personal situation. I'm over here minding my business. I'm gonna work Monday through Sunday, maybe. Okay, but get somebody else to do it. So the pelvic floor muscles start to really front on us real bad, and then we also have another type of incontinence, which can be a little, you know, it's. So you have urge incontinence as well. And urge incontinence is when you just have a sudden urge to pee. Sudden urge to pee. And sometimes, a lot of times, you may not make it to the toilet in time because you be sitting here minding your business. And you're like, oh, I gotta pee. And then you jump up and shy by the time you get to that toilet. Yeah. Yeah. So that's a thing. And sometimes also we can have very frequent trips to the bathroom at night. Okay, frequent peeing trips to the bathroom. And that's a source of urge incontinence too. Now, when you, and I'm gonna tell you straight up, can you fix this? Do you have to walk around being pissy? No, you can fix it. If you are in Atlanta, near Atlanta, wanna come to Atlanta, let me tell you who I send my patients to. She's a friend, she's a sister girl, she is good peoples. Y'all know I don't refer nobody who not good peoples or who don't know what they doing, okay? Her name is, and I told her I was like, listen, girl, I'm doing a video and I'm gonna say your name. So if your office is off the chain tomorrow, okay, I'm sorry. But her name is Dr. Felicia Rainey, and it's Rainey, Dr. Felicia Rainey. She's what we call a urogynecologist. So what she does is she has, she's trained as a gynecologist, but then she went on for specialized training for urology. So she does all things female bladder. And so for people who have stress incontinence, especially, it's something called a sling procedure. And she really does it in the office. And it's like a piece of, I want to say mesh, but some people may not understand what mesh is. Or if you can think about a piece of like lace. And it's like she puts it around like the neck of the bladder, and it's like she tacks it in there. The whole tacking thing is a whole, you know, whatever. It's a urogynecology thing. I ain't getting into it. But she tacks it in there, and it's like she straps it around, anyway, around the neck of the urethra. It's an in-office procedure, lickety split, and she have you cough, she have you sneeze, she have you the whole thing, and she keep tightening up until no urine comes out, and you go on about your business and you good. Yes, honey, so you can have that fixed. Dr. Felicia Rainey, she got you covered. I'm sure there's a bunch of other stuff that they do. I don't keep up on it because it ain't my specialty. I got too much other stuff to know and remember, but she got you covered. When it comes to urge incontinence, she's going to tell you to do these things first, but I'm sure she has a fix for this as well. But one thing that I always, if you can visualize this, and this may not be exact, right? But if you can visualize this, this is what I explain to my patients, and we kind of fix this with bladder training. And how do you do that? So imagine, let's say you have 2 alarms, right? What can I hold up right quick? I don't know. Okay, let's say you have 2 alarms, right? So this is your whole bladder, right? This your whole bladder. And usually for normal people who don't abuse their bladders, which is none of us, okay? We all abuse our bladders. You get an alarm right here that says, I gotta pee. But it's like the real light alarm. It's like do I gotta pee? I might have to pee. I think I gotta pee. But you keep doing what you're doing. You keep doing what you're doing, right? And you keep working. You keep, in my case, keep being in the operating room. You just keep doing what you're doing. And then you get a second alarm when the bladder is almost completely full that says, you gotta pee, okay? And that gives you enough time to get to the bathroom, pee, and you be like, ooh, child, thank the Lord I made it, right? The more and more you abuse your bladder, that first alarm goes away. It goes away. So now you don't actually get an alert saying you gotta pee until this. But you're so used to that first alarm, you be like, ooh, I gotta pee. And then boom, you just pee. You have no more time. And then that's when you start seeing the urge incontinence. But the good thing is, as you retrain your bladder, and I'm going to teach you how to do this, as you retrain your bladder, that first alarm will start to come back again over time, right? And not a whole lot of time, but enough time. But as you train your bladder. So what do I tell my patients if this is an issue? I will still send them to see Felicia, just in case there's like a mixed bag going on, because you can have both of these types of incontinence going on. Yeah, girl. It can be a whole situation. As I say, you need to see somebody. But what do I tell my patients to do in the meantime while you're waiting for an appointment with Felicia? Put your phone on an alarm every 2 hours. Whether you feel like you gotta pee or not, go and sit on that toilet. I promise you something's gonna come out. I promise you it's gonna come out. So as you start to empty your bladder and respect your bladder, that alarm will start to come back. And so now when you start to hear that first alarm, I gotta pee, go pee. And then you'll start to be okay. It will start to correct the urge incontinence. So as time goes on, it can improve itself. Again, with you taking measures to help improve it. Now, if you have a mixed picture and you're doing a coughing and sneezing, you ain't making it to the toilet, girl, just call Felicia and let her hook you up, okay? Just because ain't no reason for you to be out here smelling like train smoke and God only knows what. We not doing none of all of that, okay? So, I don't know if y'all heard from my other video. Apparently, when somebody had done a video and I thought it was hilarious, they broke it down and they were like, okay, so the millennials, are the women in their 40s are now cougars, and the women in their 50s are now Thundercats. Okay, well, I'm a proud Thundercat, and I don't know what comes along with that. I gotta read up on Thundercats and see what they say about them, but I don't know what comes along with that, but I'm a proud Thundercat, okay? And having smelly, oniony underarms and being pissy ain't a part of the plan, not for me and not for y'all either, because if you rock with me and you're part of the Hey Girl, Hey Nation, we're gonna get this together. We are going to get this together. So hopefully, one thing that I do want to talk to you guys about in closing is hormone replacement therapy. It may not be for you. If you're a cancer patient, you're whatever, fearful or whatever the case may be, please get some information. Get some information. Go to a provider who understands. Now, I only do bioidentical hormone replacement. Call it what you want, say what you want. It is tea. It works. It is personalized. We draw your blood. And then I listen for your symptoms, basically do a very detailed assessment of your history, your surgeries, your everything that's involved. And when we draw the blood, essentially it'll tell me how much of what hormone you need. The hormone pellets are implanted in the fat in your butt cheek, not your booty hole. Your butt cheek, it can last anywhere from 3 to 6 months. So really you'll be coming to get it anywhere from 2 to 4 times a year. That's it. And it relieves all symptoms. Hot flashes gone, night sweats gone, anxiety gone, poor sleeping gone. It's not going to make you lose weight, but it will help in that it will help your body recognize your efforts, and you will start losing weight, be it the things you're doing at the gym, as well as changing your diet. Mood swings gone. Your sex drive is through the roof. I tell people, baby, if you ain't got no D on reserve, you can't call nobody for no D. Be careful. Buy you a rose, do something. Be careful, okay? But don't be out in these streets, okay, catching no cases. We catch you down Rice Street because you done assaulted some man who wasn't suspecting, okay? So we're not having none of all of that. But yes, vaginal dryness gone. So it checks all the boxes. And it's just amazing. It's anti-aging. It helps with your A1C, your cholesterol levels, your bone density. It's just a win-win in my personal opinion. Am I on it? Yes. Do I love it? Absolutely. I feel better at 50 than I did at 40. And I hope and pray that I progressively continue to get better. But certainly hormone replacement will also help again with the incontinences, because what does it do? It helps with the estrogen, and it helps beef up those tissues, those vaginal tissues, the tissues around the urethra. Also with the increase in the estrogen, then the testosterone can drop and start to convert again. And we have a predominance of estrogen, so that will help with the armpit odor and smelling aggressive and having to get you some stuff to be out here smelling handsome. Okay, I love that. It's hilarious. So hormone replacement ultimately will take care of all of those things and just essentially treating the perimenopause. So thank you so much for listening. Thank you so much for joining Dr. Tasha, and hey girl, hey, and have an amazing weekend. So guys, listen, I don't know if I'm gonna check in too much next week. I don't think so. I am gonna post a message for everybody for Christmas. But outside of that, maybe not again until the week after Christmas. But I hope you all have a very safe and merry and loving holiday. And thank you so much for joining. I appreciate y'all to the end. All right, see y'all next week. Bye.